Welcome to all. Today's session is Jaundice. In this section, I would like to share definition of jaundice, types, causes, symptoms, complications, and dietary management. Let's move on to definition of jaundice. Jaundice is a term given to the yellow discoloration of the skin, mucous membranes, sclera, and body tissues because of accumulation of bile pigments in the blood. It results due to an increase in bilirubin content of the blood above the normal range. The normal range is 0.2 to 0.8 milligram per deciliter. The red blood cells are broken down in the liver after a duration of 120 days. The hemoglobin gives a pigment known as bilirubin. Under normal conditions, the liver cells absorbs the bilirubin and secrete it along with other bile constituents. Move on to types. Types of jaundice. Hemolytic or prehepatic jaundice. In this condition, excessive amount of bilirubin is presented to the liver due to excessive hemolysis. It leads to hepatic jaundice. In this condition, normal bilirubin production, but the liver cannot convert fat soluble to the water soluble form. It leads to obstructive or post-hepatic jaundice, in which condition the interference of normal flow of bile into the duodenum due to stones, tumors, or inflammation of mucosa of the duct. This results in a backflow of bilirubin into the bloodstream and is circulated in the body, giving a yellow color. Next, move on to symptoms. Symptoms like discoloring skin and eyes, pale colored stool, dark color urine, itchy skin. These eyes are difference between normal and jaundice eye. These babies are yellow baby, that is jaundice baby. In infant, jaundice is a common condition because of a baby's liver is not mature enough to get its bilirubin in the bloodstream. In some cases, a bilirubin level associated with severe infant jaundice or inadequately treated jaundice may cause brain damage. Coming to causes of jaundice, hepatitis, that is infection in the liver, alcoholic liver disease, liver cirrhosis, gallstones in the gallbladder, pancreatitis, that is inflammation in pancreas, congenital disease, that is disease since birth, cancer in pancreas, gallbladder. Then the liver is infected or diseased, or the flow of bile is obstructed, or excess bile is produced, then it gets accumulated in the blood. Complications: cerebral edema, renal failure, hypoglycemia, infections and sepsis, gastrointestinal hemorrhage, coagulopathy, fetal death, severe postpartum hemorrhage. These are the complications of jaundice. Next, move on to dietary management. Energy. The calorie intake advised for adult is 35 to 40 kilocalorie per kg ideal body weight, or as per the requirement to maintain a desirable body weight. Carbohydrate liberal intake should be advised. 300 to 400 gram of carbohydrate should be recommended to prevent protein sparing action, increase the glycogen stores to improve the functioning and protect the liver against infectious agents. Coming to proteins, moderate protein intake, 1 gram per kg dry weight should be recommended to prevent nitrogen balance, which may lead to hypoproteinemia. With severe jaundice, 40 gram is advisable, while in mild jaundice, 60 to 80 gram of protein is permitted. Fat. In severe jaundice, 20 gram of fat should be recommended, and in moderate jaundice, 20 to 30 gram of fat are recommended. Vitamins. Supplementation of B complex, 500 milligram of vitamin C and 10 milligram of vitamin K are essential to meet daily needs. If anorexia, nausea or vomiting is there, the vitamins may be given in the form of injections. Move on to minerals. Normal serum level of sodium and potassium must be maintained through supplementation of fruit juices and vegetables. Foods to be avoided: whole pulses, beans, red meat, high fat organ meat, fish, chicken, egg should be avoided, and also fried foods, butter, nuts and oil seeds, dry fruits, spices and condiments, peppers, chutney and pickles, strong tea and coffee, alcoholic beverages should be avoided. The red color intimate restrict fatty and fried foods, and yellow color intimate include 2 to 3 liters of fluid in our diet. Green color intimate eat more green leafy vegetables and fruits and fresh juices, soups, etc. This picture intimate fried foods and oily foods should be avoided. Foods to be included: milk and milk product, skim milk should be recommended, soups, vegetable salads, cooked vegetables, potato, sweet potato, yam, etc. Fresh fruit juices, sugar, jaggery, honey, beverages, liberal intake of water and glucose water should be recommended. Cereal porridge, cereals, jam, jellies and other sugar concentrates should be recommended. Thank you.